network नहीं आ रहा है।
A very good morning to everyone. This is Vaishnavi Pal on the behalf of SPJS Nursing and Paramedical Honorable guest speaker, Mrs. Manavalam N, Principal, Gauri Devi Nursing Academy, Durgapur, West Bengal. Welcome, ma'am. Our respected principal, Mrs. Meena Kumari ma'am, HODs of specialized departments, my colleagues, and my lovely students to this webinar session that entitles Futuristic Nursing, Explored Trends and Advancements in Nursing. It is a pleasure to have such an esteemed gathering of nursing professionals with us today. Now, I would like to request our principal ma'am to enlighten us with her kind words. Thank you.
Very good morning, everybody. Very good morning to everyone. I'm very happy to introduce my friend and today's speaker, Professor Mrs. Manavalam. She has completed her BSc Nursing in the year of 2003 in KMCH College of Nursing, Coimbatore, and she completed MSc Nursing in the year of 2009 in PPG College of Nursing, Coimbatore, Tamil Nadu. At present, she is working as a vice principal in Gauri Devi Nursing Academy, West Bengal. She conducted a government project in maternity centers when she was working in Tamil Nadu, and she also attended and presented in many national and international conferences, workshops, and webinars. I'm very happy to welcome everyone. And Manavala madam, please, you can start your presentation.
Thank you for your kind introduction, madam. May I audible to everyone? Excuse me. I'm asking, may I audible to everyone?
Yes.
Thank you for your kind introduction. So, it is a happy good morning to everyone present there, respected principal madam, the faculty members, and the dear students. Welcome to my topic that is I'm going to present today is the futuristic nursing. We are going to explore the modern trends and the technologies, what is our advancement, what is present in the nursing. So let us share the PPT. Sorry, excuse me. Is it visible?
Yes, madam. Is it visible only?
PPT is visible?
Visible.
Okay, thank you so much. So today we are going to see about the futuristic nursing. So everyone know very well about what is nursing. So we know about
madam.
everyone.
Excuse me, madam. Slideshow कर दीजिए.
Okay,
start
okay,
with slides.
Okay. Sorry, ma'am. Now it is okay?
नहीं आया. No, madam.
No.
Yes, madam. आगे.
Okay, thank you. So futuristic nursing. Everyone in nursing field, we very well know about what is nursing in earlier period. What was nursing in earlier period? What is nursing in today? At the same time, what is happening in the nursing nearby in future, as well as what is going to be in future. It is not here. well-known fact to everyone. There are the many trends that is happening worldwide, especially in healthcare system. So as a nurses, we are need to explore the advancement in nursing practices in our day-to-day life. So today we are going to see what are the newer trends that is present in nursing, as well as what are the advancements in technological advancement, what we have to explore and what we have to learn and what we have to utilize. That we have to going to see through this presentation. Is it audible to everyone? My voice is
Yes, madam.
okay. Thank you
Audible.
so
You
much.
can proceed.
Okay, we will start with the introduction of this topic. So, why the changes that is happening everywhere is the basic of the changes is the demography, the demographical changes that occur in worldwide. The reason for this demographical changes are the rapid population growth and also globalization is the major trend in nowadays. Because of these, many environmental problems as a people we are encountering, but also it is has the globalization as well as the environmental problems. It has a direct impact on the individual. It has a direct impact on the individual. It is bringing the many problems, health related problems to the individuals. So as a nurse, we are as a healthcare professional, we are the frontier. We have to provide our quality care to the persons, those who are coming under us. So we have to face these ever greater changes. At the same time, it's not only uh, mm, not only in nursing, in whole healthcare personnel, we are facing the changes. According to the changes, we have to modify ourselves and accommodate the changes in order to provide quality nursing care to the patient, those who are coming to under our care. Next, our futuristic nursing is foresighting that our occupation, nursing occupation should be restructured and following in future coming years, which in 2050. And also nurses, we are playing major role, the critical role in healthcare delivery systems. Everyone known very well, we are the first and foremost personnel, we are be with the patient always. So any changes that occurs in healthcare system, it is mainly it is first we as a nurse we have to encountering all those changes as a first personnel. So we have to always get ready to face all the changes and we have to accommodate changes in order to provide the quality nursing care. So next we will move on to the what are the trends that is present in the healthcare delivery system recently. So trends means is nothing but the changes that is what are the changes that is happening in the healthcare delivery system. First, we will see about the working environments. Nowadays, the present scenario, the working environment has tremendously has changed. Everyone, they are not doing the whole day shift. They are doing the shorter time period of shift, A shift, B shift, light shift, like that. They are according to the convenience. They are doing. They are changing the hours of duty, and also every nurses we are need better accommodation and higher salaries according to the our WHO theme 2024 theme. So we have to empower ourselves in order to better life. Like that, every nurses we are expecting better working environment. So this is one of the changes that we are encountering present situation. Second one is the nursing shortage. So the manpower shortage is worldwide is present in healthcare industry, especially for in nursing. So that it doesn't mean that we can use the less qualified healthcare professional as a substitute for the nurses. Always we have to use the nurses, those who are having the higher standard, that personnel only we have to use in order to meet the nursing shortages. That is one of the important things. And also the need of nurses is growing more and more. So we are having the tremendous opportunities in future. Next one is globalization. So now everyone known very well, we are in the arena of globalization. So the reason for this globalization is advancement in the information technology, and also we are having easy communication to people, those who are far away from us. Also, we have the many way to have the communication with the person all around the world, as well as the international travel. It's become very easier at present scenario, and the development of commerce as well as multinational corporation has developed in worldwide. These are all the reason the these are all the basic reason for the globalization. As a nurse, we also encounter the pros and cons of globalization. We are facing many challenges while taking care of the persons, those who are coming from other parts of the world also. We are not only giving care of our own sector people, we have to give care to the persons, those who are coming from other sectors of the world, other parts of the world also. And also the holistic approach. At present, we are following the holistic approach. Because of this globalization, the holistic approach becoming so problematic because we can't under all the aspects of human being. So nowadays the specialization is they are giving more importance to the specialized nurses. They are giving more emphasis on the specialization in the nursing. At the same time, we have to, because of this globalization process, or not only because of globalization process, as a nurse, we have to focus on the promotion, maintenance, and the revitalization of the health. We have to mainly concentrate on promotion of the health, maintenance, and the revitalization of health. That is the important focus for the nurse in today's scenario. So next point is cost control challenge. It is very difficult to every government in worldwide. The government, they are spending most of their income for the healthcare sectors only. So they are facing many challenges to control the cost over the healthcare delivery system, because each and every year they are facing new challenges to provide healthcare to their own country people. So that's why they are making a healthcare professional. They are not mainly making. Uh, they are encouraging us to involve in the cost control healthcare services. For in order to control the cost, it is not possible if we are not following any technological advancement in our healthcare delivery system. If we are following the newer technological advancement only, we can reduce the cost of healthcare delivery system. We should not compromise as a healthcare professional. We should not compromise our quality of nursing services in care of money. So we always concentrate on the health quality nursing care only. How we will give the quality nursing care with low cost, we can see. So nowadays the rapid changes in healthcare technologies has taken place. Newer therapies were included in all the areas of healthcare delivery system. It leads to lower the acute care stage. So the patients nowadays, take as example in oncology unit, no need to come and stay for long period of time for their therapies. They can come morning and they can have the treatment and they can go back evening. So through that, they can control the cost. So these are all the newer therapies and the technological advancements is helping to reduce the cost of healthcare delivery system. And also nowadays we are using the laparoscopic and the endoscopic surgical technologies for most of the surgery. Most of the surgery, cardiac surgeries, they are doing in the cath lab itself. They are not taking the patient to the operation theater and they are not doing as a major surgery. They are minimally, they are doing the surgery. It is very less invasive and also it is promoting the faster healing and also it is reduced the hospital stays of the patient. Through that, we can control the cost. And also the therapies, I said earlier, the new therapies, they were introduced in treatment of cancer, HIV, AIDS, and the genetic disorders. So through that, we can provide care with a low cost. So this is one of the things, newer trends that is happening in the nursing. Next, nursing practice and the theory. As a nurse, we are only learning the theories from the books and also same time we are whatever we learned from the theory, we are putting in that into practice. But much of us, we are not involving in the research aspect. But according to the recent trends, we have to involve in the nursing research and also the government and the other voluntary organization, they have to support us to do the nursing research. Whatever findings we are getting from our nursing research, it should be disseminated. It helps to build our nursing science. Whatever we are finding through our nursing research, we have to put that findings into practice. Then only we can improvise our care teams. This is what called as an evidence-based nursing practice. Whatever things we are doing, whatever practice we are doing in the clinical sectors, we have to do based upon the evidence, that evidence created from our research. So we should not take results from other discipline. We have to do ourselves research, and we have to disseminate that information worldwide. That every nurses, they can utilize this information and they put that into practice. At the same time, we have to study, have the high academic standards. We should not stand in one sector. We have to go further and we have to complete our higher studies. Through that only we can involve in the research activities. So the basic education is not enough. We have to have the higher academic education, and also advancement of in education is very necessary. In this way only we can involve in the research activities. That research activities is very much helpful for our day-to-day practice in healthcare sector. Next, apart from that, what are the trends that is present in present scenario? End of life care. So nowadays, the end of life care has given more attention. End of life care had more attention over the last few years. So as a nurse, we are also involved in many research related to end of life care services, and we have to find the evidence, and we have to use that evidence while we are doing the practice. This is very, very important. And then one more thing is pediatric. So nowadays it is growing importance for geriatric nursing, because in worldwide the aging population is growing more and more day to day. So as a nurse, we have to give care to the geriatric people. For that, we have to need specialization in geriatric nursing. This is also one of the trends. Trend. Already it has started. Okay? Many of the nurses, they are getting specialization in geriatric nursing. And next trend is a more diverse population. So at present scenario, every society in worldwide, they are having more number of immigrants in there. So more number of immigrants means many of the people, they are traveling worldwide, they are settling in different countries. So every country, they're having different types of population in it. So nurses, those who are working in different country, everyone, they must know about the different population, their cultural background, their language, their practices, their religious thing, everything. As a nurse, we have to know. Then only we can provide respectful care to the every person, those who are coming from the different origin of the country. That is called as a we have to encountering the diverse population in present scenario. So we have to know as a nurse, we are not only knowing the local language or what our own country language, we have to learn more languages, because we are not only working in our country, we are going some other countries for our job related purpose. So we have to learn all the languages, what they are speaking in their local area, and also what kind of religious practices they are doing, and what is their cultural practices related to health. Everything we have to know. Then only we can provide a respectful care to the persons. Next, health disparities. So at present day, the health disparities is a common one. It causes burden to the disease, injury, as well as death. Mainly, it is experienced by the socially disadvantaged group of people. Only the poor people are socially background less. Socially, they are from the very less background. The kinds of people only experiencing the health disparities. But as a nurse, we should not show any health disparities between the human beings. We have to treat everyone equally without seeing any race, Without we should not differentiate between race, gender, ethnicity, sexual orientation, or based upon the socioeconomic status. We should not provide any care to the patient. We should not show any differentiation between the patient. We have to treat all the person equally. That is one of the important things. So these are all the certain trends that is present in today's scenario. Next, move on to the what is futuristic nursing. Futuristic nursing means it is nothing but it is the art of. Is it audible? My voice is audible to everyone.
Yes, madam.
Okay,
Audible.
because I am continuously I am taking class, but in between I don't know whether you are listening or not. That's why I'm asking.
We are listening,
So,
madam.
okay, thank you, thank you. Next, we will move on to the definition of futuristic nursing. Futuristic nursing means it is nothing but it is the art of using the latest technology and science to promote the quality of life. This quality of life is not defined by us or any healthcare organization. This quality of life defined by the patients and the families. How they are defining this quality of life means through their experience from the birth to death, what their experience about the quality of life that they are putting into that. As a nurse, we have to get that definition from the patient, those who are coming under our care, the families, those who are coming under our care. We have to get the definition from them, and we have to fulfill the definition by using the latest technology that is called as the latest technology and science. Not only technology alone can do all the function, we have to put the science into that. So we have to incorporate the technology as well as science, and we have to meet the quality of life of the patients and the family. Next, to move on to the what are the technological innovation that is we are as a nurse when we are growing, how we are embracing the technological innovation with us. Let us see. We are always now practicing as a high-tech and a high-tech approach. So what are the transformation that has happened in nursing practice? First, we will see that. Then we will see about what are the transformation that has happened in nursing education. First, we will see about the what are the transformation that happen in the nursing that is happening and going to happen in nursing practice. The first one is enhancing patient care. So enhancing, how we can enhance the patient care means we can enhance the patient care by using the modern technologies. So whatever modern technology we are using, then we have to always have a good communication, and we have to ensure whether the patient is comfortable by using the modern technology. That is, we have to ensure always. So it is well much enough for boosting the patient outcome as well as satisfaction of the patient. So whatever technology we are using to give care to the patient, we always see whether the patient is comfortable with the technology or not. That we have to ensure. Next, to move on to the point of care technology. In today's, the point of care technology, as practically we are doing this one. So point of care technology means nothing but as a nurse, we have to remind a nurse, we have to remind with the patient always, and we have to always update the records, day-to-day records of the patient. Based upon the findings from the patient, we have to plan the treatment. At the same times, how we can be with the patient always, because already we know we are having the manpower shortage. How can we do the point of care technology means we can use some of the uh, wearable devices and the digital monitoring devices. So with the help of this, we can have the point of care technology. So wearable devices, later in this PPT, I will explain what is the use of wearable devices, what are the other kind of digital monitoring we are using in our nursing practice. With the help of this, we can abreast all the information of the patient and what is happening to the patient in day-to-day life. We can have that information instead of we are sitting the patient from our inpatient department to the outpatient department, or we are discharging the patient to the home healthcare setting also, we can continuously monitor the patient through wearable devices and digital monitoring devices. It helps through the nurses to give individualized or personalized care to the patient. Next, the technology. The first technology what we are using in nursing care is cognitive computers. So cognitive computers means it is one of the technology platforms. So here, this technology platforms is influenced by the cognitive science. This cognitive science, what it is doing means it stimulates the human thought process. It's stimulating the human thought process. So it is nothing but it is act like a human brain. It is acting like a human brain. It is train itself and it will learn itself and do itself function without any human assistance. That is called as a cognitive computers. It is and these cognitive computers are encompassed by artificial intelligence and signal processing. In easy, in order to know in easy way, it is a composition of computer science, information science, cognitive science, and intelligence science. So four science combined together, and it is a helpful for the operation of cognitive computers. Next, move on to how these cognitive computers are. What is the goal of these cognitive computers? Cognitive computing, it is main a goal of this to create the automated information technology. It's creating the automated information. It has the all the data in it. It has all the patient data in it. Through that, it is automatically producing the needed information. Whenever the physicians or nurses they need information about the particular patient means it's providing that data. So immediately we can recover the data from this and we can utilize the data. Through this data, we can do our function as early as possible. So main goal of this computing, cognitive computing is to create automated information technology system capable of solving the problems without requiring any human assistance. It doesn't need any human assistance for its data storing, but as a human, we can get the information from these cognitive computers and we can utilize all the information from this and we can give better care to the patient. At present, this is the Watson Health Cloud. This application we are as a healthcare professional we are using as a cognitive. This is one kind of cognitive computer application at present we are using in healthcare industry. That is the Watson Health Cloud application. So this cognitive computers, it have the capabilities of machine learning, reasoning, natural language processing, speech, vision recognition, human-computer interaction, and more. So these are the function done by the cognitive computers. I will explain in detail in artificial intelligence what is machine learning, what is natural language processing, everything. So all this function done by the cognitive computers based upon the real-time data, the data collected from the patients. Real-time data, the data collected from the patient. These computers that is collecting the data from the patient. From that, it is doing the processing. Then it is giving us the output of information to the healthcare professionals. So we can get the information. Through that information, we can provide better care to the patient. The uses of cognitive computers. So cognitive computers, through this, we can give the more personalized nursing care. So how we can give the personalized nursing care means here, this picture is showing that here, this cognitive computer is storing the person, single individual data. It is storing all the data of the single individual. So it is continuously monitoring that particular individual. So whenever that individual is having risk of developing any disease condition or risk of that particular person need any immediate treatment, It is immediately giving signaling to the healthcare professional, those who are connected with that particular individual through application, through cognitive computer applications. So it is immediately, it is giving, because it have all the details about the each individual, those who are uh, those who are using that particular application. It is a medium of interaction between the healthcare professional as well as patient. So it is giving signal for as a nurse. So this patient is need this kind of care. So immediately you have to go and meet that care to the patient. Like that, it giving signal to us to do the function. So this is personalized or individualized nursing care. Second one is storing patient data. It's storing vast amount of patient data. It is storing the vast amount of patient data. Whenever we need the different types of patient data, immediately, if we are typing the name of the patient, immediately it is emitting all the data about the patient without any difficulty. We can get the data and we can plan for treatment. That is the one of the other use of cognitive computers. Next, one more use of this is communication and sharing information with patient. So the nurse, healthcare professional, we can use this application to have a direct communication with the patient. The patient, they are not in the hospital setting, they are in their home setting or they are in the outpatient setting. We need to give certain instruction to the patient. We have to have the communication with the patient. Means through this application, we can have the communication with the patient, and also we can share the health related information to the patient through this application. Next use is early diagnosis, treatment, and the decision making. It helps to here not only the healthcare professional, we know the data of the patient. Here the individual person, the patient also, they are knowing their own data. So they can also, if they are finding something different in their health, means immediately they can come and contact the healthcare professional and they can early diagnose their condition and have the treatment. The same way, we as a healthcare professional, we can use this data to find to diagnose early about the patient condition, and we can plan the treatment, and also it's helpful for the decision making, mainly informed decision making. Informed decision making means here the patients also knowing very detailed about what is happening to their health. They are detailedly knowing their conditions, so they can take decision according to their wish. That is called as an informed decision. They are knowing everything, what is happening in them, what may be, what kinds of treatment plan if they are undergoing, what may be the pros and cons of the treatment, everything it is well known to patient also. So they can take decision without any hesitation or without any confusion. They can take decision, they can undergo the treatment. Next one is it acts as a reference. How it is acting as a reference, I will show the picture. It has the vast amount of data, not large amount of data in it. Most of the data that's stored in cognitive computers are unstructured data, but it has the key medical terms in it. Take an example. If you want to see about the medication, we can just typing the medication, we can see the medication of that particular patient. We can see the disease condition, different types of disease condition, and what we already this is the data this is the data of the patient, those who are already under our care. Okay, we can use that that data as a reference for future. Some of the patients they are coming with the same kind of profile, means we can use this data as a reference. We can refer this data and we can know what type of treatment we have given for that kind. We had given for that type of patient, what type of nursing care we provided the same profile patient earlier. That for that reference we can use this data, so we can cross reference between the patient. So for that this is very much helpful, and also it has the images also in it. So through that images we can refer. So the already take as an example of we are seeing one stroke patient MRI scan in present scenario. We are having the sensitive. Already we had this kind of patient earlier, but we are not remembering what type of care we have given to the patient, what type of procedure we done to the patient. We are having confusion, means immediately we can use this cognitive computer data and we can refer through these images what findings we have we found during the time, what type of treatment we had given during the time. Everything we can get it from this data and we can utilize for the future patients also. So that's why it is acting as a reference. So that's all about the cognitive computers. Next, move on to the artificial intelligence. So artificial intelligence, everyone knows very well, I think so, about the artificial intelligence. This is the ability of the computers to independently convert the data as into knowledge. This knowledge help us to guide decision and may help the computers to take autonomous action. So this is about the artificial intelligence. In simple term, it's a branch of computer science. It is concerned with creating the machine to think and make decision independently without any human intervention. So that is it is a machine is doing it function without human intervention, or otherwise we can have use this artificial intelligence technology to provide. We can incorporate with our practice. We can have connection with this artificial intelligence and we can do our function without our need also. In some certain type of emergency, the computer itself, it sends and it do its function. So it always do the complex task. It is not previously it is only done by the human being. All kind of complex tasks nowadays done by the artificial AI techniques. Actually, this AI techniques is working by using algorithms and data. How it is working means it is based upon the algorithms and data. So algorithm means it is nothing but it is a set of instruction to be followed by the computer. Set of instruction to be followed by the computers. It is for its operation. It is giving step-by-step instruction to the computers how you have to get the data, how you have to convert the data into operational definition, how you have to do your action. Every instruction is given by these algorithms. Actually, this algorithm, it is present in the way of mathematical. It is present in the statistical way only. It is present in the computers. So this computer data, it will be converted into a different thing. It may be converted into text message. It may be converted into voice message. Like in different form, it will be converted and it is getting operated. Clear artificial intelligence, because I'm having some doubt. Okay for you? Are you understanding?
Yes, madam.
Are you for? Yeah, yes, okay. So what are the artificial intelligence tools as a nurse we are using? Means as a nurse, we are using the AI techniques for clinical decision making, for mobile healthcare services, we are using this one, and also for the sensor. So you take this example of we are as a ICU nurse, we are monitoring too many patients. We are connecting the patient with AI applied computers. Means this AI applied computers is always monitor the patient whenever there is a dropping in the vital signs of the monitor or anything has happening to the patient. Immediately it sensor and it gives signal to the nurses to act immediately. So for that purpose, we are using this technology and voice assistance. It gives the voice message to the nurses. So immediately we can go nearby to the patient and take action. And also robotics. We are using the nursing robotics. It is based upon the AI technology. We are using the nursing robotics for different purpose. Later I will explain where and all we are using the nursing robotics. So this is about the artificial intelligence development. So it is developed in 3 different stages. We don't no need to see too detail about the development of artificial intelligence. So in stage first, artificial intelligence coined during the first stage of its development. That time, the computers that imitated the early development of artificial intelligence, the computers that imitated the human being, They adopted the intellectual capacity of the human being. They acted like a human. Next is second stage of its development is machine learning. Machine learning means nothing but the computer is called as a machine here. So that machine that is learning from the algorithms and the data that's stored in the computers. So they're converting these algorithms and the data into a operational process, and it is implementing that operational process into real setting. That is called as a machine learning. Nothing but it is learning from the statistical data and putting into the implementation in real-time world. That is the second stage development. Third stage, at present development in artificial intelligence is deep learning. So deep learning means it is one subset of machine learning. Here, the computer, they structure the computer like a human brain. They structure the computer like a human brain. So like our neurons, it has the artificial neurons in its, like our neural network, it is also like a human brain, it is also doing its functions. So this is the stages of development of artificial intelligence. At present scenario, what type of application we are using in healthcare industry is Chat GPT and chatbot. This is the application at present we are using in the healthcare industry. So these are all the subsets of or different function of artificial intelligence. Already we seen about the machine learning and the deep learning also we seen. Apart from that, the natural language processing. What this natural language processing application is doing means it generate the text. Whatever data we are feeding into this system, it is generated that in as a text message. It answer our question. It is extract. We can extract the whichever content we need. We can extract from this data. And then if we need any classification of the data, we can class this computers. It is classify and give the data to us. And also it is translate the data into meaningful information. It translates the data into meaningful information. This is one of the function. Next function is expert system. This expert system of AI, how it is acting means it is giving the specialized experts means they are very much they are a pro person in the particular field. Like that, expert means according to the specialization, it is giving guidance. Take the example of the patient is admitted in ICU with a bacterial infection means this expert system, it is diagnosing the bacterial information, and also it is giving information what type of antibiotics we can prescribe the patient, what kind of antibiotics we can administer to the patient. Like that, expert advice it is providing to us to carry the function. This is about expert system. Next, move on to the speech recognition. So whatever the patient is communicating or whatever the patient wants to communicate as or otherwise the healthcare person we wants to communicate, it recognizes the speech and it is giving the speech, it's converting that speech into text message, or whatever text message we are typing into this, it's converting the text message into speech. This is one of the things. Next one is planning. It helps for planning the nursing services. It helps for planning the nursing therapies. Different type of therapies we are, or different type of nursing care we are providing nowadays with the based upon the data provided by the AI. Next, robotics. Already I said, later I will explain what is the use of this robotic. Artificial based upon the AI technology only, the robotics are acting. Next to vision. So vision, the machine, it is capturing the machine that is capturing the images from the patient images, and it is giving the information about the patient. So it helps to image recognition, and also it is giving the information for us to diagnose the condition. Sorry. This is about the subsets of artificial intelligence. I'm going little bit fast because of time. So the AI, how it is applicable in the healthcare sector means Nowadays we are using the AI technology for robot assisted delivery. Through that, we are saving. It is helpful for cost control services. And also virtual nursing assistants. We are using the robots for our assistants, or virtual reality or augmented reality. This also are coming under AI technology. We are using this technology in order to meet the nursing shortage. And administrative workflow, from admission to discharge, there are many processes that is happening in the hospital sectors. So for everything, we need many manpower. There is a chance of error will happen, but we are using the AI technology, means we can reduce the errors in administration, and we can the workflow also is go on very smoothly without any distraction. Next to fraud detection, it is helpful to detect the fraud or faults in the treatment as well as in the payment. For everything it is helpful to detect. And the dosage error detection, which is mainly helpful for detect the medication dosage error. It is as happening. This is the major problem now. Every nurses we are facing medication error problem. So EA technology, it is helping to reduce the medication error. And also many of the patients. Next one is connected medicine. Many of the persons nowadays, many of the person in ICU, different types sectors of the ICU, we are connected them with a technology or a applied computer. So it is monitoring the patient day-to-day life. So this connected machines, it helps to do the proliferation themselves in the machine. No need of human made proliferation. We no need to do any proliferation in the connected machine. The AI application itself, we do all the proliferation. And it is helpful to say the clinical. We are involving in the clinical trial. So clinical trial research, many of the nurses, we are involving in the clinical trial research in the practice sectors. We are storing many data of the many different types of patients. So this AI applied computers, it helpful to store all type of data in it. Whenever we need immediately, it is giving all those data. Next, it is helpful for the preliminary diagnosis without it is accurately giving guidance to diagnose the disease. And also automated image diagnosis. Whatever images we are uploading into the AI technology computers, means it is immediately have the great storage capacity, and also it is giving the proper accurate diagnosis for us. So there is a lesser chance of misleading the diagnosis. There is a lesser chance. Next, cyber security. Whatever data we have the doubt, we are saving all our data into the computers, whether it is secured. Means this AI technology, it is giving the confirmation of whatever data we are uploading into these computers. It is always have the cyber security. So these are all the some of the application we are using in our healthcare sectors. Apart from that, in nursing especially, we are using the certain type of algorithm in critical care setting and general care services, mainly for adverse drug reaction. For that purpose, we are using nurse, we are using, and wound care also we are using for to prevent the faults of the people. We are using infection control areas. We are using this AI technology, and also the pediatric healthcare field also we are using the AI technology. Next, move on to the, that's all about the AI technology. Let's move on to the augmented and the virtual reality. Virtual reality means it is nothing but it's a technology that provide almost real and a believable experience in a synthetic and a virtual way. It is giving the real experience, but it is not in a, it is present in real world, it is present in the synthetic world. But augmented reality means it is enhances the real. There's something happening in the real world, but that happening is enhanced by the computer generated information. Something we are seeing the patient, but we are not seeing too detail about the patient. But with the help of the computer generated information, we can see too detail about the patient. Nothing but the example. Next slide I will show. This is the first one is example of virtual technology. Second one is example of augmented technology. Virtual technology means nothing is present in real world, but they are using some headset. Through that they are experiencing the real things in a synthetic environment. They are experiencing brain. Here they have given example brain. They are not seeing the real brain, but it is created visually, so they can experience what is the structure of the brain. Everything they can experience, but that is not a real one. That is called as a virtual reality. Augmented reality means here the person which will be the person will present. That is the real world person will be present, but in order to know detail about the each organ and how it is functioning, what we have to see in the person organs means that we can see through the augmented reality with the help of the specialized augmented applied devices. We can use the specialized devices. Through that we can see the function of the organ and how we can I will give such an example how this augmented reality is working. So this is the difference between the augmented reality and the virtual reality. Augmented reality means the real world experience. The virtual reality means entirely virtual world. So here we are integrating the computer generated images with the physical world. Here we are only immersing into the digital environment. And also here we can distinguish in AR technology, we can distinguish what is real world, what is computerized information. But here everything we are always into immersing into the digital environment. We are feeling we are in some other environment. So equipment, what type of equipment we have to use for AR means smartphone is more than ever, but it has the augmented reality application in it means we can use the smartphone, and are otherwise AR compatible devices also available in the markets. In VR headsets, in the specialized headset we are needed for this. And also we can easily use the AR, but it is hard to use the VR. So these are the certain example for augmented reality. Students, please switch off your videos. Just doing something. It is distracting. So augmented reality means if we are as a healthcare professional, we are having augmented reality in our smartphone means we can always find out the devices, the healthcare equipments, which is very much essential on the time of someone collapsed on the road. Means immediately we need defibrillator to save the life of the person. If we are in your smartphone, we are having the AR technology means immediately we can locate where the defibrillator is available, how we can take the patient to there. Like that, we can easily locate the things. And also next one is some of the examples I have given for breastfeeding classes. For breastfeeding classes, this mother would AR technology application. She wore the spectacles that had the AR technology in it. Through that, nurses can see how the mother is feeding her baby and whether she is properly positioned the baby, whether he is properly feeding the baby at a particular time or period or not. That everything she can visualize through the AR technology spectacular. This is one of the example. The nurses, while day-to-day practices, we can use the AR technology. So some of the example I have given, we can easily find the veins through using the AR technology before starting the IV infusion therapy. So these are the simple example for VR technology. This is the video for AR technology. At last, I will show this video because at present in worldwide we are using the VR technology for our demonstration process. As a nursing student, we are using the VR technology. Please, students, switch off your audio because you are doing some unwanted things.
All participants and students are requested to mute your videos and audios. Please Please cooperate for this webinar. All students are requested to mute your audios and videos.
Ma'am, is it
Yes,
time
madam.
permit?
Proceed.
I will play the
Yes.
this video, or otherwise, can I?
It's up to you, madam. No problem. Yes, madam. Proceed.
Okay, this is VR technology as a nursing.
With access to our VR system in nursing, we're providing the students with an immersive way of accessing skills that not every student would originally have access to. And this is a great equalizer among our students, giving them all the same opportunities to provide some of these higher acuity skills that they might not necessarily see through the course of their learning.
The start of this VR project was in our cardiac unit in our health assessment class, and part of that unit was learning to place a 12-lead EKG on a patient. And our nursing cohort has 30 students, and so it can be really difficult for us to have the resources to be able to place those things on patients and then have an instructor come and try and sign us off, and it can just be a really time-consuming process.
With this VR project, as soon as we press submit, we get that feedback. We learn where to correctly place the EKG leads. We learn why we got a question wrong with the NCLEX practice at the end of it. So that instant feedback and the ability to practice combined really helped create a learning experience that I thought was really fruitful.
We want to bring it in to do more invasive tasks that are just not quite as realistic on a mannequin, and that we definitely don't want to practice on each other. Our faculty have been really excited about the possibilities to give students the actual practice at listening to breath sounds, listening to heart sounds, looking at wounds, looking at skin conditions, bringing in whatever other media that we can include in this VR to make those assessment opportunities a lot more realistic.
So the VR technique where we are using in nursing, so for distracting patient during the procedural pain, and then we can manage the depression patient by using the VR technology, and for dementia care, for teaching about the mobility, and also in case of anxiety and the phobias, we are creating the virtual environment through that we can make the patient to confront the situation where and all they have the fear. Through that, in a controlled way, they can overcome the fear, and also it is helpful for neuro rehabilitation and vision correction also. So in this area, we are applying the VR technology. In present scenario, we are applying this VR technology and simulation techniques in nursing nursing classes for our demonstration purpose. Next is scanners. So the medical scanners are used to produce the pictures of human body. This image is very much helpful to evaluate and assess the diagnosis of the disease condition. Next is wearables. So everyone knows very well about the wearables because many of us we are using the wearables like a watch for our tracking our steps while we are going for a walking. Apart from that, nowadays the wearables we are using for too many purposes. It is acting as a health advisor, nutritionist, and a fitness coach for us. So there are different types of wearables that is available in the market. It is also not only monitoring your steps and the pulse rate, it is monitoring your ECG and it is monitoring your blood pressure. Everything everything monitored by the wearables. So the wearables, parallel this wearable used. Wearable nowadays used as a tool of telehealth because in telehealth means we are having the communication through the telephonic conversation, or we are with the help of modern technology. With the help of computers, we are providing the services to the patient who are far away from the area where the healthcare professionals are living. So these wearable devices, the patients having the wearable devices in the hand means they can monitor the health status. If any changes the person means immediately they can approach the healthcare professional. Then they can take the immediate management. They help to monitoring the patient, not only their blood pressure, not only their pulse rate, it's monitoring the blood pressure, ECG, everything monitored by the wearables. And also through wearables, we can give health education to the patient, and also it is helpful to monitor the physical, mental, and the psychological status of the particular individuals. So these are the certain benefits of the wearables. Next, move on to the holographic. So holographic means it is nothing but it is a three-dimensional images So these three-dimensional images, not what we are using at present situation. It is not like that. In naked eye, we can use, we can see these three-dimensional images. It is created by the computer technology. So this three-dimensional hologram technology very much helpful for healthcare professional to learn the things, and also for planning the surgery or diagnosis the medical condition, and also it will produce the image. That image is helpful for better understanding about the tissues and the organ, both interior and exterior. We can understand in a very well way by using the hologram, 3D hologram. So this is the one more video about the 3D hologram they are using in the cardiovascular surgeries.
The world of medicine is transforming from open surgery to minimally invasive interventions. As a cardiologist performing these procedures, I rely exclusively on medical imaging to guide me. Over the past few years, real-time 3D imaging has become a crucial tool as our procedures become more and more complex. I need advanced visualization tools and better ways to interact with the images.
The Holoscope Eye is the first and only holographic system delivering a full and tailored solution for real-time medical applications. What makes our product truly unique is the display of a real 3D hologram with unparalleled usability. Our freestanding system relieves the user from the burden of wearing a head-mounted device and enables prolonged use without any fatigue or nausea.
The Holoscope is by far the most advanced 3D visualization tool I have experienced. Having a real hologram of the heart in my hands based on CT, real-time ultrasound or any 3D data allows me to focus in and fully understand the complexities of the patient's 3D anatomy. When implanting a valve using a catheter, I can slice into the holographic aorta. Using the holographic system, I can appreciate the dynamic anatomy of the mitral valve leaflets. I can literally touch, mark, locate or navigate a path for the intervention, and these are all essential for a successful procedure. This technology provides me with more confidence, potentially resulting in shorter procedures and better outcomes. If I can see...
Okay, this is the way hologram 3D imaging is very much helpful to see about the internal part of the organs and what is external and also external parts of the organs in two details in different angles. It helps for better understanding as a nursing professional. Also, it helps for better understanding what is going on, and that without a minimal harness to the patient, we can practice in the hologram 3D images, and we can practice there. Then we can practice directly into the patient, in patient. So next, move on to the genomics and the biotechnology. Genomics means nothing but this is a study of molecular biology. So the nurses, those who are working in the oncology sectors and those who are handling with a genetic disorder patient, they must know about the genomics, because most of the present scenario, most of the conditions are inherited. Most of the conditions are inherited, and also we have to know two details about the DNA. By studying this genomics, we can know about the two details about the structure and function of the genome. If any variation, means how we can identify the variation, how to diagnose and how to treat the patient, everything we can. That's why in nursing syllabus also the genetics also it has included. In your higher studies, you are having the specialization in genetics also. Biotechnology means nothing but we are learning the engineering technology in it is how to do the molecular diagnosis, gene therapy and vaccination. For that purpose, we are applying the biotechnology. The nurses of genomics and biotechnology in nursing is helpful for pre-conceptional counseling and prenatal testing. The helpful newborn screening, and also the disease susceptibility. The person, those who are risk of developing their genetic disorders, we can find out by knowing the genomics. It is better for screening and diagnosis, and also for therapeutic decision making. It is very much helpful, and also it is helpful to monitor the burden or complication of the disease condition, and also what is the how many percentage of chance of recurrence. That also we can know it by knowing the genomics. Next, the nanotechnology. Nanotechnology means nothing but it is conversion of the larger molecules and atoms into smaller particles. That is called as a nanotechnology. Presently, we are using the nanotechnology in the treatment of cancer as well as in the treatment of genetic disorders. The nurses who are working in the oncology unit and the genetic wards, we must know the nanotechnology because many of the pharmaceuticals companies, they are using the nanotechnology based medications. They are preparing nanotechnology based medication. As a nurse, if we are not knowing what is nanotechnology, it's very much difficult to administer the medication to the cancer patient and monitor the side effects of the patient and providing the nursing intervention in order to reduce the side effects of this nanoparticulated medication administration. So as a nurse, we must know those who are working in the oncology unit as well as genetic related units, genetic therapy related units, we must know about the nanotechnology. So where and all we are using this nanotechnology in healthcare industry means gene therapy, drug delivery, and cancer therapy, genetic disorder, some of the ocular diseases treated by this nanotechnology, and cardiovascular treated by this certain brain and spinal related disorders also treated by using the nanotechnology. It is mainly applicable in pharmaceutical areas. Next, move on to the telehealth. The telehealth, everyone known very well about the telehealth. I think so. It is very much flourished during the time of pandemic period, the corona COVID period. So now in Indian government also giving more importance to the telehealth because in our country, most of them, they are living in the very remote area. They are not possible to get their day-to-day healthcare services. Through telehealth, they can it is easy approach to them through the telecommunication media. So through telehealth, what are the services we can provide to the community? Means we can integrate the medical devices through this telehealth media. Through that, we can monitor the patient and we can diagnose the condition and give treatment to the patient. And also we can have the video chat through this, and also we can through this we can have the wireless communication with the patient, and also we can monitor the health records links of the patient, and also we can have the different monitoring system of the patient. Whenever some changes that occurs in the patient condition, immediately we can, through this monitoring system, we can get the signals, and we can immediately give care, meet the needed care of the patient also. Next one is self-service kiosk. Kiosk means nothing but it is not available in our India, but it is a self-booth. Self-booth means it is like a telephone booth. This telephone booth, it will be present near to the highly populated places. The persons, those who are need the healthcare services through telecommunication, they can go and approach this booth. This booth, sometimes it is operated by the man, or otherwise it is operated by the computer system. So they can go and monitor their health condition, because many applications were available to monitor the health condition of the patient in this booth. They can share the data, they can monitor their conditions. Through this, they can get the have the communication with the doctors and healthcare professionals. They can get the health related advices. These are all the different areas of telehealth services. Apart from that, AI powered healthcare assistants we are using today, that is called as a nursing robot. What is the main purpose of this nursing robot? Is this is having the direct interaction with the patient, and also it is modified the behavior according to the sense what it is sensing from the environment. Based upon the need of the patient, it will be modified its behavior and it take care of the patient needs. Next, apart from that, service robots we are using in healthcare industry. Service robots means nothing but it assists the nurses in day-to-day tasks. What are the service robots we are using in healthcare industry? Means rehabilitation robots, telehealth robots, pharmacy robots, and mobile logistic robots. Rehabilitation robots we are mainly using to teach the rehabilitation exercise to the stroke patients. Telehealth robots, already I said, telehealth robots, it is like a human telephone. It is we are placing these robots in the key. I said no telephone booth like monitor services which is available. There we can place the telehealth robots. It is monitoring the patient condition. And the pharmacy robots mainly helpful for reduce the medication error. It is helping to prescribe the correct medication and ordering the correct medication. Next, mobile logistic robots. This is very much helpful for meal ordering and cloth ordering, as well as medication ordering, medication arrangement. For everything we can use the mobile logistics robots. Next, move on to the exoskeleton. Exoskeleton means nothing but it's a device designed to provide support to the nurses for their lower back, upper body, and the extremities in order to reduce the workload to their musculoskeletal system. Because as a nurse, we are encountering we are facing more musculoskeletal related problems because we are handling the tasks such as lifting and transferring the patient. And so in order to avoid all those complications, we can use the exoskeleton devices. Next, apart from that, we are providing the holistic nursing care to the patient. This everyone knows very well, and the culturally competent care. So we are giving care to more different type of population. So in order to maintain, have a trustworthy relationship with them, have a effective communication, we must have a cultural competence in ourselves. Next, social determinants of health. Social determinants of health. So nowadays, the in Indian government also it is giving more emphasis on the community-based healthcare services. Through community healthcare services only, we can attain the goal of sustainable health. So for that, we have to know which environment the person born, live, play, work, and age. That environment we have to know through detail, and we have to provide the care based upon their environment where they are living, doing their work, they are doing their day-to-day activities. That should be known. So that is called as a social determinants of health. Next, move on to that's all about the transformation of nursing practice. Within 5 minutes, I will finish what are the transformation that is happening in the nursing education. What is the future direction of nursing education? We have to include social determinants of health in our nursing curriculum. That is very much important. And also we have to extend our education beyond the classroom. We have to always have the hands-on training from real life environment. And also always we have the inclusive learning environment. Without have the differentiation, we have to include all the diverse population into nursing sectors. Then only we can have we can learn the different culture, their practices, everything we can learn it. And also curriculum, whatever curriculum described for nursing, it helps for developing the critical thinking of the nurses. And also cost effectiveness also more important. We have to give more importance to the cost effectiveness. And the faculty development program also very much essential in nursing. So how we are embracing the technology in nursing education? That virtual reality and the simulation techniques. We are most widely nowadays we are using the virtual reality for our demonstration. We can demonstrate all kind of procedure through virtual reality. What is the main advantage of the virtual reality? Means it is improving the critical thinking skills of the students, and also it is better. It helps for better decision making in a controlled environment, and also it is giving very less harmful to the patient because we are learning in the visual environment, not we are learning from the real environment. So less damage to the patient. Next, there are different types of mobile learning apps are there. This based upon the individual. It is help for individualized learning. And whenever we need, we have an interactive sessions in this, and we can clarify the doubts. Artificial intelligence. We are applying the artificial intelligence in our education also. That's also providing the very personalized learning experience. We have to adapt the content based upon the individual student needs. So we, as a teacher, we are not seeing the individual student needs. If the 50 students are there in the classroom, means we are concentrating equally to the 50 students. But under AI technology, it is giving the individualized or personalized learning experience based upon the each individual students. They can get the assistance and they can learn from this artificial intelligence techniques. Apart from the holistic curriculum, redesign is very much essential in present and nursing education. Always we have to collaborate. Interdisciplinary training is very much essential. And then we have to cultivate the critical thinking. And the continuous assessment and feedback also very much important in present scenario. And also nowadays, more nurses, they are choosing the specialization. Like take as an example of assistant nurse manager, case management nurses, charge nurses, clinical development specialists, healthcare informatic nurses, infection control nurses, like that. Many specialization has happened in nursing. So we are more number of specialized nurses are growing in worldwide. This is the what are the innovation they are bringing in the placement means. So they are providing the virtual clinical experience and also they are having the partnership with the community organization and also they are doing the twinning program. Twinning program means nothing but 2 years of students. Many of the colleges or universities, they are having the tie-up. Indian universities, they are having the tie-up with foreign universities. So the students also they have do 2 years nursing courses. Nursing course in India, and the next 2 years they can go to the abroad and they can have their training in abroad. That is called as a twinning courses. That's all about the transformation in nursing education. Next, at last, we can see what is the impact of this information technology in nursing. So there are many technological advancements we are utilizing nowadays in our practice as well as in our education. At the same time, it has impact in our practice as well as education. But we as a nurse, we have to know how to balance the information science and the nursing science. For that, as a nurse, we have to do certain things. Always nowadays, we have to be technically savvy and we have to learn the technical information. We have to have the up-to-date, we have to update our knowledge related to the technological advancement. At the same time, whatever technological advancement we are putting into the practice, we have to see the ethical consideration. Ethics is very much essential while we are applying the technology on patient care. So if the patient is not willing to take under the technological advancement, means we should not compel the patient. You have to you have to utilize the technological advancement. Like that, we should not invest the patient. We should not compel the patient. So these are all the second. And we have to, whatever data we are getting from the patient, we have to save it properly. The security is very much, confidentiality of the data is very much essential. Like that, certain ethical aspects also there where we are applying the technology into our nursing practice, that we have to consider. I think you got some point about the technological advancement in nursing practice and education. I hope it is very much, it is helpful to you people. Thank you for your patient listening. Ma'am, can I close the session? Or any queries? Excuse me, ma'am.
Hello. Good afternoon, ma'am.
Good
I'm
afternoon.
here for a vote of thanks. I am here for vote of
Okay.
thanks. Am I audible for you?
Yes, you are audible.
Okay. Okay, thank you, ma'am. I, Kirti Lal, nursing faculty of JS Group, to express my heartfelt thanks to Mrs. Manavalam and ma'am, Professor and Vice Principal of Gauri Devi Academy of Nursing. Thank you so much, ma'am, for this wonderful session for Futuristic Nurse, which is very helpful for our future and resources. I also like to thank Dr. Sunita, ma'am, a chairperson of JS Group, for giving this opportunity to us for conducting this wonderful webinar. Thank you so much, ma'am. I also thank our principal, ma'am, Professor
Meena Kumari, who have always been supportive for us and initiative encouraging us. Thank you so much, ma'am. I also have to thank our nursing faculty, dear student, and all participants who actively participate in this session. So with a small gesture, I am thanking to all and by this session. Thank you, everyone.
Thank you so much, Madam Manavalam,
Thank you so much
for accepting our invitation for this webinar today. And thank you so much for your detailed explanation about futuristic nursing and detailed explanation. It was very useful for everybody. I feel today I understood, even I understood and learned a lot actually from futuristic nursing. Thank you so much, Madam, for accepting our invitation. Thank you so much.
Welcome, ma'am. Welcome. Thank you for this opportunity. Thank you, ma'am.
With this, we'll wind up the session. Thank you, everyone.
Thank you.